Colonization and health outcomes. Stripping them of the land, culture, and families. Colonization in Australia nearly destroyed the indigenous population. It has resulted in inequity, racism, and the disruption of Aboriginal and Torres Strait Islander cultures. In fact, it has been the most detrimental of the determinants of health that continues to significantly influence Aboriginal and Torres Strait Islander health outcomes today. Indigenous Australians are the custodians of the oldest culture in the world. For over 60,000 years, the Australia's first people from more than 400 nations lived in close relationship with their land. They lived, fished, hunted, and harvested this land, but only for their own subsistence, living in harmony and balance with seasonal changes of the environment. However, about 230 years ago, the life they knew started to change. It happened abruptly, forcefully, and mercilessly. The first Briton fleet arrived with 1,500 convicts, crew, marines, and civilians, bringing diseases, hunger, and death. Within months, more than half of the indigenous populations living in Sydney had died from smallpox. They were hunted, enslaved, slaughtered like animals. Their land, now occupied by the British settlements, had been cleared, the water polluted, the fish population was depleted, and the animals were unsustainably hunted. Red hot echidna spikes are burning me. Comfort me, sister. They soon started to become more and more dependent on white food and clothing, and they started to starve. In just one century, the indigenous population of Australia, estimated between 1 to 2 million prior to the British settlement, was reduced by 90%. According to the data from 2016, there were about 800,000 Indigenous Australians living in this country. That represents 3.3% of the Australian population. Of this total, 265,000 were living in New South Wales, representing 3.4% of the total population, whereas in the Northern Territory they represent 30%. Over 500,000 Indigenous Australians lived outside the greater capital cities. Two centuries of dispossession, discrimination, segregation, and deprivation resulted in a colossal social and economic disadvantage between Indigenous and non-Indigenous Australians. Such detriment, sustained for generations, helps us to understand the gaps in the average health status between these two groups and the ample variation observed in the health outcomes within the indigenous population. A safe and secure home is a major factor supporting the health and well-being. The lack of appropriate housing can lead to negative consequences, including poor health, unemployment, low education, and homelessness. Indigenous Australians have 50% less chances to own their homes. They are 10 times as likely to live in social housing. They are 3 times as likely to live in overcrowded dwellings, 9 times as likely to require assistance from homelessness services, and 1 in 5 will live in a house that didn't meet the acceptable standard. Indicators of poverty demonstrate that Indigenous people are 2 to 3 times worse off than non-Indigenous. Over 120,000 Indigenous Australians are under the poverty line. The employment rates for those aged 15 to 64 years are below 50%, while for non-Indigenous, employment rate is above 70%. The rates of engaging in risky health behaviors are usually higher among individuals in low socioeconomic status. It wouldn't be different among Indigenous Australians. There is a significant association between unemployment and smoking. 43% of Indigenous Australians aged 15 to 24 years referred to smoking on a daily basis in 2018. Regarding substance abuse, the proportion of Indigenous Australians who consume alcohol at levels that exceed lifetime risk is about 20%. 27% used an illicit drug in the past 24 months. More than 60% of the burden of the disease among the Indigenous Australians is due to a chronic disease. In 2018, about 15% reported having a cardiovascular disease, and almost 25% were found to have high blood pressure. Cardiovascular disease was the leading cause of death of Indigenous Australians, accounting for 12% of all deaths. More than 50% of the Indigenous hospitalizations were due to a cardiovascular disease for people aged under 55 years old. Diabetes was the second cause of death, accounting for 7% of all deaths among the Indigenous Australians. The prevalence of diabetes is 80%. Indigenous Australians are 4 times more likely to develop diabetes than non-Indigenous Australians. In 2016, the Indigenous suicide rate was double than the general population. 1 in 3 Indigenous youth experienced high levels of psychological stress. Intentional self-harming is the second cause of death for males. 38% of Indigenous Australians referred having 2 or more conditions. All those rates rise with increasing remoteness. The Close the Gap strategy has made some improvements to Indigenous health since it was introduced in 2008. Sadly, only 1 among the targets was achieved by 2018. Regarding the social determinants of health, there has been an improvement in the proportion of Indigenous Australians who completed Year 12 and above. with a significant increase in participation in higher education. However, Indigenous Australians are still extremely underrepresented in the tertiary sector. This year, the Australian government released the new National Agreement on the Closing the Gap. It had been developed in partnership between Australian governments and Aboriginal and Torres Strait Islander peak representations. It focused on 16 targets to improve areas such as education, employment, housing, health, and well-being. It acknowledges that to close the gap, Indigenous Australians must determine, drive, and own the desired outcomes in partnership with the government. A new chapter for the First Nations people has just begun.